Can you give us insight into what is happening in the mind, the feelings, the thought patterns of someone that is suffering from anorexia?
Sure. Well, number one, it's going to be individualized for each person. So the answer I'm giving is really general, right? But the way that I describe often is, all right, well, I'm going to take a step back. So eating disorders are egosyntonic, at least at the beginning. So what that means is engaging with them, it actually like feels good and feels soothing. This is to be like in contrast to egodystonic, right? Which means like OCD is egodystonic, which is that it actually doesn't feel good. I hate having this problem, right? But with anorexia or eating disorders in general, they originally start off as it's actually helping me to feel better. And so then this gets to like what's happening in someone's mind with an eating disorder, right? What they're specifically anorexia. There's going to be, by definition, there's going to be thoughts about and obsessions about your body and how you look and almost like acceptance from other people or even yourself that's specifically related to just, I look wrong, I feel wrong. A lot of times the thoughts, it's like, I feel too much. I just like feel like I'm suffocating, too big, like stuffed, this type of language is often used. And to many people, they think like literally they just like feel quote fat, right? I'm also not against using the word fat. I don't know why, like we have to have this.
Censor our language, yeah.
Yeah, so someone else can, I won't.
Okay, well that begs the question, body dysmorphia, what is it? Is that an implicit part of anorexia? And is body dysmorphia an eating disorder? Because what you're describing is this obsession of body image.
Okay, so body dysmorphic disorder itself is a completely separate diagnosis. In fact, if you have an eating disorder, you can't simultaneously be diagnosed with body dysmorphic disorder for the same exact obsessive thoughts as you would for the eating disorder. So theoretically, you could have body dysmorphic disorder about something else, like, I don't know, like something on your face or whatever it may be. Like you have a specific obsession, but that obsession is distinct and completely separate from any of the eating disorder.
Yeah.
So there's actually, if you look, the DSM has a line that's like in body dysmorphic disorder, that in order to diagnose that disorder, it cannot be that those thoughts are the same as with an eating disorder, anorexia or bulimia.
Yeah, fascinating. And I forgot to mention in the roadmap, we will also talk about overlap and compare and contrast eating disorders with body dysmorphia, which we kind of just did, but also obsessive compulsive disorder. So I'm going to pick you back up on that egosyntonicity in OCD relative to the egosyntonicity in anorexia.
Just to go back to the body dysmorphic comment. So distorted body image is the phrase I use, right? That does happen in eating disorders. And there actually is misfiring in the brain. So specifically, I'm talking about anorexia and bulimia, right? There's another category of eating disorders, otherwise specified eating disorders with a bunch of other subcategories. Okay. And so that's like atypical anorexia. Essentially, that just means anorexia, but your body weight doesn't indicate that you technically meet criteria for anorexia nervosa. So with these diagnoses, right, there's misfiring in the brain. Like your brain chemically is not perceiving, or as a result of chemical misfirings, it's not perceiving your body in the same way that it would if it was actually like in a more stable.
Yeah. And what I asked you earlier to kind of define it, it's so difficult because it's so individualistic, meaning so many different stories and people and so many different paths can lead to the destination of anorexia nervosa. And like you mentioned, there's different types. There's restrictive types. There's what do you call it? The purging types with compensatory behaviors. Part of what Sarah said is the fact that in anorexia that it's egosyntonic actually makes it more complicated to treat, because oftentimes these anorexic patients they don't have the insight, or they don't have the retained insight that their deranged eating behaviors is actually working against them and detrimental. I mean, is that right?
Yeah. So what I often talk about with clients is, and even their families or loved ones, is the eating disorder started off with usually with actually quite good intentions. And people often think, I can't possibly have an eating disorder. I didn't plan to, or I didn't try to. Mm-hmm. But that's not necessary at all. In fact, a lot of the time they accidentally develop, right? Mm-hmm. And what's happening is they have these good intentions of, I want to belong more. I want to be more lovable. I want to feel like I fit in, or I want to feel like I have a sense of control. These aren't necessarily active thoughts that they're aware of, but on some subconscious level, that's usually what's motivating it. Mm-hmm. There's some level of I feel better about myself when I do A, B, and C.
Yeah.
And when I don't do that, I feel worse.
Yeah.
And a lot of times the behaviors they engage in that lead them to feel better are reinforced by their environment, right? Mm-hmm. You look so much better. Oh my gosh, you have so much self-control. I wish I could do that. How did you do that? Things like this. So especially for, younger kids, preteens, teenagers who by dint of being that age don't have a sense of self yet, right? Mm-hmm. And are just wanting to start to become their own person and feel like they have their own value and know who they are and feel good at something, and their brains aren't particularly developed, right? Mm-hmm. And so they don't know how to interpret the world well. They just in general are trying to make sense of everything. So this is a very quick, easy way to feel okay, I feel like I'm good at something and people are proud of me and I feel like I belong and I'm proud of me. I feel better about myself. Yeah. When I do this, this equals this. And there is a dopaminergic
exactly. Reinforcement.
Exactly.
Yeah.
And so
that's dangerous because you have a disordered behavior that has a significant risk to one's health. We'll give you some statistics on morbidity and mortality later, but you have this disordered eating that then is not only internally rewarded, mm-hmm. but might be rewarded by your environment as mm-hmm. well. And not only that, becomes conflated with their identity.
Correct. The biggest issue that I see, because I've worked in higher levels of care for eating disorders, and what that means is there's different levels of care, like hospital, residential, partial hospitalization, intensive outpatient, and outpatient. The big with adults and adolescents. And the thing that becomes really the most difficult is when the eating disorder really becomes a part of their identity, which you usually would see in adults when they're teenagers. They haven't been alive long enough for that to be the case. But that's when it really becomes difficult.
Yeah. Now, they consider it part of their identity. The disordered eating is rewarding for them. So why do they present to a professional? Why do they know that something's wrong? Is it at the behest of their family? Mm-hmm. Why would this person who feels like it's just them, it's their identity, it's rewarding, I'm gaining something from this, why would they even come see a professional in the first place?
Great question. Okay, so for teenagers, a lot of times they're just brought there, right? Mm-hmm. Even for adults, a lot of times they're I'm having problems in X, Y, and Z area of my life. People seem to report this as a problem. A lot of times, eating disorders is just a side note. You might start off with one like anorexia, restricting type, and it transitions to purging type or transitions to bulimia or binge eating disorder. But so just because you have one diagnosis doesn't mean that you won't transition to something else.
Mm-hmm. Interesting.
Just FYI. Yeah. But what usually happens is they have a lot of ambivalence about recovery. And that reminds me also that a lot of people don't believe in a full recovery, which I do. Mm-hmm. So.
And we're going to talk about what is actually one of the audience questions is a full recovery possible? What's the definition of that? We will get that to the end when we take audience questions.
Okay. So that's the first thing, because they're like, sure, I guess I don't want these people to be mad at me or to have these problems at work or school or this to interfere with my friendships. But I feel either they feel conflicted or they're just not into it at all, recovery at all, because the risk of not having what feels like it's actually saving their life, although it's actually slowly killing them, mm-hmm. it feels like too much. So our work together is to first just figure out what actually is going on. Is this as egosyntonic as you think that it is? Mm-hmm. Because the reality is that it's not. Yeah. But we just haven't really understood what's going on. What I say and explore with patients is usually, what you were hoping to get from your eating disorder is, which typically when we dive in all the way, is just to honestly just to have a positive sense of self and to feel like you are like worthy of love and belonging.
Esteem.
Exactly. And I can dial that in with like, it takes a few layers to kind of get there.
Yeah.
But typically that's where people like kind of guide the conversation, whether they intend to or not. That is what you can have in a full recovery. So what you intended with the eating disorder, like, okay, those are great, like underneath everything, those are great goals. It's just the way that you wanted to get there is going to kill you / it's just not going to work.
Yeah.
It's just not going to work. So you want to go to France. Okay. Well, you can't walk there from California.
Yeah.
So that was your plan. Like you walked to the airport and got that far and it felt like it was going to work, but you can't continue the rest of the way. So we actually need a completely new plan for how to get there. It's not that you can't feel lovable and belonging and have a sense of like true self-esteem. That can be there. But the way you want to get there, AKA through the eating disorder, is not the program.
Yeah. Yeah. And that's what makes it so difficult and why such deep work needs to be done is that if their self-esteem, their feelings like they are worthy of love and attachment, if their identity is tied to this disordered eating, then there can be a significant fear with letting go of this disordered eating and gaining weight because they feel like this is what makes me special.
Yes.
This is what makes me lovable.
Yes.
What it's worth the whatever problems are accompanying it because this is what allows me to be worthy of like attachment and love and acceptance and praise and all the rest of it.
Yes. And what makes it harder is as they start to stop engaging in the behaviors, society, generally speaking, there are people around them, unless they're very informed about eating disorders, tends to stop reinforcing the like, oh, you look so good. Oh, you have so much self-control. They start to like eating disorder recovery, 100%, you feel worse at the beginning than you do much further down the road.
Wow, that's so important. Now, I'll just repeat what Sarah said because it's that important.